Okay, so I'm going to go over this news article called COVID Vaccine Results Are on the Way and Scientists' Concerns Are Growing about this particular vaccine. And this is the one for the Oxford AstraZeneca vaccine that is being developed, which I don't know too much information about it, but I do believe that it is a transgenic type of vaccine where they take the spike protein that is off of the SARS-CoV-2 coronavirus and they put it onto a dummy virus, and so they can multiply the dummy virus and then insert that dummy virus into the human or into whatever model organism, and then they see whether or not an immune response is elicited. Excuse me. So, what I first want to do is go over a video that I did called "Predicting COVID-19 Neurological Conditions," and I made this almost 3 months ago. And here we were referencing since coronavirus spike proteins and coronavirus proteins in general, and not just coronaviruses, but many viruses, many pathogens, they will have biomimetics, or they will have proteins that look similar to the host's proteins. And as by mimicking the host proteins, they are able to evade the immune system, or if the immune system does end up recognizing them, it actually can cause suppression of the immune system in some way, shape, or form. So in the case of SARS-CoV-2 coronaviruses, one of the common things that it does is they will mimic the ACTH, or the adrenocorticotropin hormone, by mimicking it, as your body produces antibodies against this particular part of the coronavirus, then it ends up suppressing the immune response and suppresses your ability to produce, or I should say, it suppresses the ACTH in your body. Now, another thing that these coronaviruses seem to be able to do is cause some form of neurological condition. So this can be done through, say, inflaming neurological tissue, which could cause autoimmune diseases by your own proteins being interacted with the immune system. So if you can imagine, if your nerves are inflamed, you bring a lot of immune cells to the location. Well, you might have a few damaged proteins that are floating around in the solution, and those are your own proteins, and that might be able to elicit or cause an immune response. And after you developed antibodies against your own proteins, you then could have a progressive neurological condition be the result of that. Okay, so that's one of the ways that you can create autoimmune conditions and against your nerves. And another one would be if the virus themselves have certain epitopes or have amino acid sequences that looks very similar to your own. If some of those happen to be produced close to nerve cells or in proximity to any particular type of tissue, and you develop an immune response at that local area, you might also inadvertently create autoantibodies through that process as well. Okay, so in the case of coronaviruses, we seem to have a significant portion of neurological manifestations, and a lot of these neurological manifestations are often partially attributed to autoimmune diseases. So, for instance, transverse acute myelitis, so myelitis, inflammation of the spinal cord, that is one of the side effects of contracting SARS-CoV-2. Or encephalitis, inflammation of the brain, that's another thing. Or peripheral nervous system inflammation, such as, Guillain-Barré syndrome. All of that has been reported to be a common manifestation or common sequelae of contracting SARS-CoV-2. Now, what I want to bring our attention to is this news article, which is talking about the vaccine. Now, the vaccines need to undergo severe or very rigorous clinical trials. And the reason why is if these coronaviruses are mimicking our own proteins, if we just take the proteins from the coronaviruses and put them into our body, we could inadvertently be using some of these strategies, or I should say, the coronavirus will be able to elicit some of its function or some of its pathogenicity onto the human, even though it is not the full coronavirus, even if it's just the spike protein. If one of the ways that SARS-CoV-2 damages the body is through your immune response against it, well, we won't want to just inject the protein into our cells, because that is also going to cause some of the pathogenicity. Now, we definitely need to argue, well, if everyone's going to contract the SARS-CoV-2 coronavirus anyway, would it not be better to contract it and to create the immune response with just the protein versus the living or the reproducible virus? And I would say yes, it's probably much better, much better to have it with just the protein. However, we need to do those trials. And what we're experiencing right now with some people having adverse reactions to the vaccine trial is that that might not necessarily be the case. Okay, it might not be that the vaccine is significantly better than contracting the SARS-CoV-2 in reference to the autoimmune diseases. When it comes to the ARDS, the acute respiratory distress syndrome that takes place, the participants are not getting that from the vaccine because that would be a completely different that's a completely different thing that's going on. What I'm talking about explicitly right now is some of the autoimmune conditions that can arise that you would be getting from either the vaccine or the coronavirus spike protein. Okay, so I've spoken long enough. Let's continue. So several ongoing coronavirus vaccine trials could announce game-changing results next month. But as anticipation grows, concerns are growing about whether the vaccines will clear safety trials, what they will achieve if they do, and the risk that the approval process will be influenced by politics, or at least seems to be. Okay, so this is extremely important. Optics are important, right? So if people believe that politics is influencing whether or not a vaccine is going to be approved or not, that is a problem, because then you will have people that will not want to take the vaccine if it is proven to be efficacious, or you will have people that if it actually is influenced by politics and it shouldn't be taken, that people will want it anyway and start hollering and screaming and protesting because they want the vaccine to be released to the public when it is still not safe. So that's something that can happen. So 2 weeks ago, the UK trial of a leading vaccine candidate developed by the University of Oxford and pharmaceutical company AstraZeneca restarted after a 6-day pause to investigate safety concerns. Okay. So halted trials of the same vaccine in South Africa and Brazil have also since resumed, but the US FDA has not yet given the green light for the US studies to start again. The trial sponsors have so far released few details about what caused the pause and why the trial was allowed to resume. Some scientists say this lack of transparency could erode public trust in the vaccine. And you know what? I mean, from the very beginning, I was seeing public trust be eroded about vaccines. So it is good. It's necessary. If you want to develop a product that people trust and will partake in, you need to have at least, especially if it's politically charged, you need to have transparency in the entire process. If you don't, then you could self-sabotage the entire thing. So in the background, fears have intensified that political meddling could see a vaccine approval for emergency use without sufficient evidence that it works. US President Donald Trump has said he wants a vaccine ahead of his country's presidential election in November. That's 1 month away. So, to assuage concerns, the drug companies behind 3 leading coronavirus vaccines in phase 3 trials, AstraZeneca, Pfizer, and Moderna, last week released documents describing how their tests are being conducted. These trial protocols include benchmarks for safety and success and details that had not been made public before, including how soon the vaccine's preliminary results could be reported. The documents also describe how the companies might stop trials early to get fast-track approval. Okay, so here are 3 areas that scientists are watching closely. So safety and transparency. Initially, researchers were too concerned when the media reported that enrollment in the UK trial of the Oxford vaccine had been paused on the 6th of September because of an adverse reaction in a participant. So these adverse reactions in clinical trials are quite common and often unrelated to the treatment, which some research says is probably the case with the Oxford vaccine, given how soon the UK regulations allowed the trial to resume. So some media outlets have reported that the participant developed transverse myelitis, an inflammation of the spinal cord. But AstraZeneca and the University of Oxford, the UK trial sponsor have not released information on the person's condition. So, I mean, this is something that I want. I want to have a little bit more information initial on this initial person. I want to know, was this a pre-existing condition? Did the vaccine make the pre-existing condition worse? Right? And is it progressing? Is it seeming like it's going to resolve? Is it seeming like a certain drug cocktail will be able to completely remove these effects, or are these effects permanent? And what I also want to see is, well, we know that this is happening in some people. What if it's happening subclinically in a bunch of other people, right? So you have clinical manifestations, things that you can see and you can feel, and you report your symptoms right away, because it's like, I do not feel good. I do not like the side effects of whatever drug trial I am being subjected to. So that would be a clinical manifestation, right? Something that you can write down. But I want to know, are there a lot of subclinical effects that are happening, and if a lot of these subclinical effects are actually cumulative or progressive diseases, well, I would like to know if that is happening in people, because it could be that two people showed this transverse myelitis immediately. One of them supposedly had multiple sclerosis. So if that is the case, that it caused, or I should say, it erupted or pushed people over the edge until they made clinical transverse myelitis, well, is it pushing healthy people or people without any multiple sclerosis or any type of neurological autoimmune disease? Is it causing it, at least in low subclinical concentrations or subclinical amounts in those people? That is what I want to see. And I'm currently not given enough confidence right now that those details are being looked at. So, especially as it says here, it was fast tracked and it resumed very quickly. The moment that they figured out that, oh, it was this person's undiagnosed multiple sclerosis, and then they started right away, that does not sit well with me. Okay, since we know people with multiple sclerosis seem to have clinical complications, especially when they contract SARS-CoV-2. So continuing, some scientists have criticized the lack of information being released, especially when it emerged that this was the second pause in enrollment because of an adverse reaction. So information sheets given to the participants in July noted that the trial had previously been halted when a member was initially reported to have developed symptoms of transverse myelitis. And so I have the document over here. So here these adverse events. So here they're talking about serious reactions that can take place. So this is the document that they give to the participants so that they can have informed consent over the trial that they are about to participate in. And here under serious reactions, they said these adverse events have not previously been seen following administration of similar vaccines. No, let's see. Okay, we'll just start at the beginning. With any vaccination, there's a risk of rare serious adverse events such as an allergic reaction. These may be related to the immune system or the nervous system. Severe allergic reaction to vaccines or anaphylaxis are rare, but can be fatal. In case of this unlikely event, medication for treating allergic reactions is available, and the investigators are appropriately trained in the management of anaphylaxis. Reactions in the nervous system are also extremely rare, but can include an illness called Guillain-Barré syndrome, which is a condition in which people can develop severe weakness and can be fatal. These adverse events have not previously been seen following administration of similar vaccines using the CH80OX. I forgot. This might be, okay, we'll say ChAdOx1 as a viral vector, but one volunteer in the trial of ChAdOx1 nCoV-19 developed symptoms of transverse myelitis, which is inflammation of the spinal cord, which has not required medical treatment and is being investigated, though the cause is uncertain. And this one, they wrote this before they knew that the cause, or how to phrase that. So this person had undiagnosed subclinical multiple sclerosis, right? So I don't know whether or not this was before or after they figured out that there was multiple sclerosis involved, but just because there's an involvement of a disease doesn't mean that the vaccine didn't also play a role, right? So you can have compounding factors in any type of reaction. So, information sheets given to participants in July noted that the trial had previously. Oh, yeah, I read that. So, AstraZeneca says the person was later diagnosed with MS, and an independent panel decided the condition was unrelated to the vaccine. But the company and the University of Oxford have yet to say whether the two participants received the vaccine or a placebo. So, if it turns out that two people have developed transverse myelitis, given the relatively small number of people who have received the vaccine, so remember, these are still early trials and they're not being given to an exorbitant amount of people. Like the fact that two people have developed clinical symptoms in a small group is worrisome. And these people have developed symptoms very rapidly, like very quickly, right? So we don't know if other people are also going to develop symptoms, but since neurological conditions and frequently autoimmune neurological conditions, those take a long time to manifest. So if it takes a long time to manifest, then we might end up, how to phrase that? If this is fast tracked too quickly without doing due diligence, we could experience significant neurological conditions. So McIntyre notes that viral infections have been linked to both transverse myelitis and multiple sclerosis. Cases of transverse myelitis have also been observed in people with COVID-19, she says. To rule out a link between the vaccine and the conditions, researchers must run statistical analyses that compare rates of the conditions in participants who received the vaccines with those in people who got the placebo. This is probably what the FDA is still investigating before it decides whether or not to allow the US trials to resume, says McIntyre. So here I'm going to backtrack a little bit because here they're saying that as long as the complications are not statistically significant from the placebo, that it should be allowed to continue. My personal thought is as long as the complications are less than contracting the virus itself and significantly less than contracting the virus itself, then I think that is actually I think that is a better metric because especially if everyone contracts the virus, well, that's going to be very similar, at least immunity wise or autoimmunity wise, that between the coronavirus and the spike protein vaccines, you're probably going to see a lot of the same manifestations. But if the vaccine is significantly safer than contracting the virus itself, then the vaccine is probably still the way to go, right? So, I mean, with every drug, with everything you put in your body, there's always going to be the risk of adverse side effects. And so, but if those adverse side effects are a lot better than the disease itself, it's probably worth it, or it's usually worth it. So, anyways, here it sounds like they're going to try to do some statistical analyses to see if it is significantly worse than placebo. And if not, then they might continue the trials back in the United States. So more details about why the trials were paused and then later resumed should be made public, said Hilda Bastain, who studies evidence-based medicine at Bond University in the Gold Coast, Australia. The lack of transparency from the trial sponsors is a concern and could lead some participants to pull out or cause people to decide not to get a vaccine once they are approved, said Bastian. We really need people to have confidence in vaccines that are moving quite quickly, right? So, well, I mean, you want them to have confidence if you've done due diligence, but if you haven't done due diligence, then I would assume that having a lack of confidence is a good, healthy thing, right? If a vaccine is politically pushed through, then that's not safe to it's not necessarily safe. It could still be safe. We just haven't proven it to be safe. So having that healthy skepticism would be very beneficial, right? So AstraZeneca and Oxford did not respond to questions about calls for greater transparency, but AstraZeneca Chief Executive Pascal Soria, I don't know how to pronounce that, sorry, said during a panel discussion hosted by the World Economic Forum on the 24th of September said that clinical trial guidelines recommended against disclosing information about individual participants to avoid compromising their privacy and the integrity of the study. So, Soria said that given the public interest in these vaccines, companies were discussing what kind of transparency they could offer without compromising trials. So, I mean, that is true. You don't want to, obviously, if you're a participant in a trial and you got some complications, and knowing that there were only 2 people that that are known to have developed these neurological complications. Let's say you're a relative and you know, oh yeah, my child or my cousin decided to participate in a vaccine trial, and oh, I haven't heard from them in 2 months now. Then all of a sudden you are able to. There's at least one person who knows someone who is a likely candidate to be one of these complicated or one of these patients who have demonstrated complications due to the trial. So that's just what I want to. It is possible to use it's either inductive or deductive, but some form of reasoning to figure out whether or not the person that they know is the person that is demonstrating these complications. And so you don't want to affect their privacy, right? You don't want to say too much, because if you say too much, then all of a sudden that is a privacy violation of that particular participant. So I would say with that, well, I guess what I want to talk about now is what are some possible solutions to this problem. So if it is the case that the generation of autoimmune antibodies is causing these neurological conditions, or let's say you already have the autoimmune antibodies, except you have them kept in low enough concentrations. Well, if you are given a vaccine or if you're given the antigen, your body might ramp up production of the autoimmune antibodies that you already have. And so in that particular case, you might end up getting a reaction that you wouldn't otherwise have had you not either, one, contracted the coronavirus, or two, taken the vaccine. So if you are someone with underlying multiple sclerosis and you have a lot of these anti-nerve autoantibodies in your body, then if you're given the vaccine, the cells that make those autoantibodies, they are going to recognize the antigen very quickly, in fact, because they're probably at pretty decent concentrations, even though they are still low. And after you make a lot of these, after they recognize the antigen, they'll start hyperproducing this antibody that doesn't just attack the antigen, it also attacks you. And so you could have a subset of the population that will always have this severe reaction to the vaccine because they have these underlying these low levels of autoimmune antibodies, especially against nerves or what have you. Now, granted, these people are probably going to experience the same exact thing if they were to contract the coronavirus themselves, right? So even if they have that complication, they would still have that complication with the virus. So it's probably better for them to get the vaccine and deal with the neurological complications than it is to contract the disease and then have the neurological complications. But maybe you could find a way to screen out all of the people who have this predisposition to neurological complications, and then you give the vaccine to everyone else, and then you can develop herd immunity that way. You can develop herd immunity, and that protects the vulnerable who cannot take the vaccine or who would develop more neurological conditions from contracting the coronavirus itself. Okay, so that's one thing that could happen. Now, what I'm also concerned is, what if people are given the vaccine and then they develop the autoantibodies, but they're still in small concentrations? Which means, let's say they get a booster shot of the vaccine, or they actually contract SARS-CoV-2 later. Would that cause a second dosing or a second increase of these autoantibodies and cause more neurological conditions later? That is something that needs to be considered. Okay, but generally, my thought process is, what can we do to develop a safer vaccine? Well, that would probably involve developing, not using the whole spike protein. The whole spike protein does not need to be used to develop these vaccines. We could theoretically use parts of the spike protein. We could use parts of the spike protein that we know are not causing these neurological manifestations, or they're not causing these autoimmune responses. Let's just use the parts of the spike protein that elicit a robust and a significant immune response explicitly against that particular epitope. We can do that. Okay. We have the technology. We can do the genetic engineering if we need to. So that's one way. Another way is we could use, if we could figure out where on the spike protein, what parts are causing the issue, then we could mutate those areas so that they no longer look similar to the human proteins or to the host proteins. So there are ways that we can engineer a safer alternative than the spike protein itself. Because remember, these spike proteins, they have spent billions of years mutating into to find the most effective strategy at evading the host's immune system, right? So these spike proteins have a history, or any virus surface protein or glycoprotein, they have had plenty of time to involve better and better strategies of evading the immune system or modulating the immune system, right? So perhaps it's probably better we don't use the straight up highly sophisticated spike protein or surface proteins. Maybe it's better to screw them up a little bit, and by screwing them up, we can destroy a lot of the functionality of it while still maintaining the ability for it to be recognized by your immune system, and then have cross immunity with the native coronavirus. Okay, so that is pretty much all that I want to say about this. Hopefully, there is not anyone else who shows clinical manifestations, clinical neurological manifestations. Um, I mean, I'm not very confident because I've been screaming about this from, 4 or 5 months ago. I've been screaming about this, so I'm not very confident. But this is better than nothing by far. So with that, I think I'm going to head on out, but thanks for watching, and if you have any questions, comments, or concerns, please leave them down, and I'll try to respond as quickly as possible. So with that, thanks for watching, and hopefully I will see you tomorrow.